Welcome. I'm your host, Jesse Swear, nationally recognized inclusive fitness trainer, Silver Sneaker Flex instructor. Find out more about me, visit my website, www.jesseswear.com, and subscribe, as today I'm going to continue my series on the hip as we do a standing hip extension. Now our hips get tight from that seated position, and we do a lot of flexion for the hip. That's moving the hip forward or moving the hip up. But we also want to provide extension to that hip as well, because if we work it in one direction, we need to work it the other direction. It's kind of like in work your bicep, you also have to work your tricep. You work your chest, you also have to work your back, because they coincide, and so does step flexion or flexion of the hip and the extension of the hip as well. So for those instructors, for those older adults, or for that aging population that's staying at home, we want to gain more mobility and stability so that you have greater ability to stay living in place and being independent. So I'm going to utilize a chair. You can use a wall, you can use a table. A higher up position is always going to assist and help you. This chair sits a little lower because it is a little more modern. I'm going to face the left. I'm going to stand nice and tall, and I'm going to use my right leg. My feet are together in this position. They're going to be in a horse stance or even in a narrow stance. I'm going to be nice and upright, and all I'm going to do is stay in that upright position, and I'm going to take that right leg back as far as I can take it, and then I'm going to bring it back in. Now, I want my leg to stay straight. I do not want to bend that leg. I do not want to bend forward to try to get more extension of the leg. When I say extension of the leg, that's my extension. Now, clearly, if I bend more, right, I can take that leg higher. If you do that, you're ruining the exercise, and you're not really fully working on an extension of the hip. We want to work on extension of the hip, so we want to stand nice and upright. We want to stay in that upright position, and we want to take that leg back. Hold it briefly for a moment. Bring it back. You do not want to lean forward. You do not want to bend forward. You want to be able to get extension in this position. And as you do that, you also want to squeeze those glutes, and you're going to engage that lower lumbar as well. As you do this, you're going to see some improvements in the hip. You're going to see some improvements in your mobility, and you should see improvements in the stability and ultimately your ability. Peace, my friends. If you did the right side, you also have to do that left side as well.